so that we can start. And then after that, we have a presentation from Professor Lars Montelius, and then, if time allows, a little bit of debate. The floor is yours, David.
Thank you, Pablo. Hello, everyone. So for this introduction and for the opportunity to be with all of you today, it's much appreciated. So on behalf of the World Health Organization, the Regional Office for Europe, during the next few minutes, it's a short presentation. I will go over 3 topics. So first, I'll do a very brief data reality check, in particular considering the wider effects of the COVID-19 pandemic. Second, I will go over some reflections on how we can overcome this situation, just some personal reflections. And finally, I will touch on some key priority actions that the WHO Regional Office for Europe is planning to develop in the framework of our recently approved European Programme of Work 2020-2025. So let's begin with a data reality check. Next slide, please. So as you may know, in September 2015, the 193 United Nations member states agreed on the 17 Sustainable Development Goals. From these SDGs, 12 goals, 33 targets, and 57 indicators have been identified as health-related SDGs. So in this map, you can see the availability of data to inform global health-related SDG monitoring. So unfortunately, as you can see in this map, the availability of recent underlying primary data is uneven. So for most countries, recent primary or underlying data were available for between half and 80% of the health-related SDG indicators. For almost 1/5 of countries, however, over half of the indicators have no recent primary or direct underlying data. So for example, according to one of a UN report, some countries in Africa and Asia, on average, have data available to monitor only 20% of the SDG indicators. So this clearly shows that significant gaps exist in the availability and quality of data to inform global health-related SDG monitoring. Many national health information systems require urgent improvements, starting with not only greater investments in human and technical resources, but also in interagency collaboration. So strengthening health information systems is a core priority for WHO to ensure that countries have the basic needs to work in the digital age. Next slide, please. Another important fact, this one connected to the COVID-19 pandemic, is that along with the work of health workers, data are a key tool to effectively tackle this pandemic. So during these unprecedented times, I have had the opportunity to lead response teams on the ground, and I have seen firsthand that data are more urgently needed than ever to inform critical interventions. So in particular, to learn about the epidemiological situation, healthcare capacities, including health system functions, public health capacities, and availability of effective pharmaceutical interventions. Data are also needed to determine multi-sectoral and non-pharmaceutical measures, such as lockdowns or temporary suspension of socioeconomic activities. And finally, to monitor the wider effects on population health, because this pandemic and the actions taken to control this virus have an impact on population health beyond the direct morbidity and mortality it has caused. The range of these effects is broad and include, among others, disruption of health services and social, economic, and psychological impacts. Despite the progress achieved using digital solutions, the power of data has still not been leveraged. So now, of course, we have learned a lot from this pandemic. So for example, it has reiterated that real-time data and effective integration of different data and information systems can facilitate effective, timely, and data-driven decisions. It has also highlighted the consequences of a lack of health data standards, a delay in receiving data, a lack of integration and interoperability between different data systems, and an insufficient number of trained people to properly manage and use data. So in this first part, I just wanted to highlight the importance of robust data and the current challenges and data gaps that countries are facing even when there is political commitment at the highest level. Next slide, please. So with this data reality check in mind, we now move to some ideas that countries should consider on to address these barriers in the context of the new normal. So this is the current situation. As you know, COVID-19 pandemic has not ended yet, and until there is an effective vaccine or treatment, everyone remains at risk. So we all need to work together to protect ourselves and others. So in the context of data in particular, we also need to consider this new normal. And for this, I would like to just suggest some principles and steps. So first, as key principles, we suggest 4 actions that member states should agree to be successful in mitigating the health, economic, and social impacts of COVID-19 and beyond. So these key principles are: facilitate data comparison and secondary use of data, enhance the monitoring surveillance systems, also exchange relevant data, and finally promote a data-driven culture to allow that everyone is able to access, use, and manage data. And if we want to be successful in executing these principles, there are 5 steps that member states, countries should work on together. So first, to establish a high-level data coordination mechanisms in charge of implementing a data governance strategy composed of multi-stakeholder partners. Second, to define data flows and processes which could be manual or digital. So not everything is digital. So also having good processes documented, even they are manual, is super relevant. And third, to adopt data standards to facilitate integration, interoperability, and forecasting at the national and the global level. So these first 3 steps are critical to success, and every country should move in that direction. The next 2 steps that I'm going to propose are equally critical, but will depend on the availability of financial resources. So the first one is to invest in data and digital technology because it is essential and will facilitate the automatization of different data and measurement processes. And according to the Paris 21 Partner Report published last year, international funding for data and statistics is only around half the level that it needs to be, which means that a lot of work is still needed on that end. The last step is related to empowering citizens, since everyone needs to understand the rights, the benefits, and risk of sharing data, especially related to ethics, privacy, and security. So the implementation of these ideas will lead us to an environment where political decisions are data-driven. Next slide, please. Countries are not alone in this journey. So to achieve these recommendations, countries can, of course, rely on institutions such as the European Commission, the OECD, or WHO. So in our case, the WHO Regional Office for Europe, I am pleased to inform you that 1 month ago, ministers of health and public health leaders from the 53 member states of the European region endorsed a new 5-year vision, the European Program of Work, that we call EPW, that it will be in place from 2020 to 2025, that sets out how WHO Europe and its member states will work together to meet citizens' expectations for health, including strengthening data and health information systems. So under this program of work, under this EPW, and in regard to health data, we are committed to developing big data capacity in surveillance, modeling and policy monitoring, also developing a European health data governance framework through a European health data governance charter, and complementing classic data collection by robust use of big data, online surveys, consensus panels, and experts' opinions. So in particular, these actions will help us address the recommendations made by the 194 WHO member states during the last session of the WHO Executive Board that was held in May. So from a data point of view, these actions will contribute to reducing data fragmentation and the reporting burden on countries. It will also enhance the capacity of data systems and increase data availability. So the question is, how are we planning to do this? So first, with you, with your collaboration, and in close coordination with key partners, such as the European Commission or the OECD, and other international organizations such as the World Bank, by setting up a new data team considering the new normal. Second, by reviewing the available evidence, something that we are currently doing in the fields of big data and artificial intelligence, and for which we expect to show some results by the first quarter of 2021. And of course, by making this evidence available to decision makers to facilitate investment and adoption. And third, by providing technical support to countries on the ground. So if we work together, we are convinced that it is just a matter of time before we will be able to provide the right data in the right place and at the right time to leave no one behind and make a measurable difference in people's health. So, and with this, I conclude my presentation. Thank you so much for your attention. I look forward to any question or comment that you may have. And in addition, my email is on the first slide of this presentation. So please feel free to reach out to continue this conversation. Thank you so much.
Thank you so much, David, for this short, concise, but very, very effective presentation. It's so interesting to realize that the WHO is gaining such a tremendous important role now in the context of the Brexit, right? So it's so interesting to see, and I'm very, very glad to see that you are quite active, busy, and congratulations for this framework that you have reached to facilitate among these all the states of the region. Congratulations, David. It's very important. It's for me a novelty and a surprise. So without further ado now, Professor Lars Montelius, the floor is yours. I'm going to stop here at the last screen from David's presentation. That with your permission, David, it will be shareable, right, for the Altata forum?
Yeah, absolutely, yeah.
Thank you.
Okay, thank you very much. So, and thank you, David, for these good insights. I would try to expand a bit about it in some parts. So I will start by sharing my screen, and then let's see if it works. So can you see my screen?
It's perfect.
Okay, very good. So now I just would like to change my camera. Let me see. Yes. Now you can see me looking into you, right? Yeah, I guess, and you can hear me. Good. So if you look on this picture to the left, this is a vision of the future that was made 1962 in an Italian magazine about the pandemic situation in Europe, how it should look like 2022. And you see everyone is isolated in the old smaller vehicle. And I think we are kind of there already now, right? With the physical social distance that we are speaking about, which is the only tool for the time being that can actually be used in order to prevent COVID-19 to prevail. Right? So I'm going to speak with you about the issues about the health and healthcare for revival and renewal and the possibility to start up the economy. So I would do that by first just say some few words about INL, because most of you may not know what INL is. So INL is a very strange kind of organization. It's one of the intergovernmental research organizations, and it's the only one in the whole world focusing on nanotechnology. It was started a little bit more than 10 years ago by the incentives from the Spanish and Portuguese ministries of science in order to set up a new kind of entity that would have a particularly important role in developing nanotechnology, but in a global perspective. So I was recruited as the director for now 6 years ago. And when I came, there was, due to the economic crisis, there were not so many people working there. It was about 70 people. Now we are a little bit more than 420 people from 40 different countries working there. So now the house is full. So besides the research, we have a startup program, we have an incubator, we're having a scale travels program where we articulate science to the community, and we're having our own IP Ventures, which is our commercial vehicle for exploitation of IP and knowledge. We have representation in different places: Scandinavia, Israel, Dubai, Hong Kong, Shanghai, Austin, Texas, and Brussels, and in Boston as well in the United States. So this is the frame of INL, so to say. What we do at INL is to put efforts in 6 different areas. So you see them here in the middle of the picture. One is about the future, or the food for the future. Another is in precise personalized health tech, which is the topic of today, I would say. And then sustainable environment, advanced materials and computation. This includes the quantum materials and quantum computation, smart digital nanosystems, and clean energy. And as you say, as you can understand, all these kind of 6 areas, they are kind of interconnected with each other, so they're not totally alone. In total, 25 research groups working together in these fields. So there is not one single research group that is only one of these clusters. So the groups are participating like in a matrix structure. So it is very fruitful and very functional. If we go to the precise personalized health tech cluster, just to get a feeling what we mean by that. So everything is about health tech. So we are not a health provider. We do not do health research, but we do health tech. So in the health, we have to the left side, the diagnostics, therapeutics, theranostics, drug delivery, biomarkers, and understanding. That's what we do. That's what we work on. And then on the engineering side, we have the sensors, microfluidics network, fluid mechanics, electronics, NMR, integration, photonics, microscopy. And that's where the engineering effort is. And what we are looking on in the health tech is the interface, to bring these things together in order to populate the interface. And the whole mission for INL is to work in the interface. So it's an interface between different technologies, the interface between different sciences, the interface between different organizations, public, private organizations, the interface between different governments, the interface between different organizations, etc. So that's where we focus in order to do something highly innovative and highly interesting for the future. Our work is partly using Horizon 2020 or European funding, about half of the activity, and the other half is working with companies in commissioned research projects. So if we look on a kind of a snapshot of the digital economy, I mean, just as a simplified view of it, to the left you see the data generation. So in order to have data, we need to generate the data, of course, right? So we need sensors, we need something that measures something that can be generated into a data stream. And we are working on the micro, nano, and quantum sensors. And the paradigm now is go from a general sensor to a very specific one, also including the kind of edge capability to compute and harvest and digitalize and aggregate data already in the chip level or in the embedded sensor level. So the form factors that we use on everything from kind of solid pieces to something that you can embed into your fabrics or into your display or into even your body, into certain specific body functions, etc. If I have this data, then this data needs to be communicated, of course. And here we have the speed and secure communication. We now have 5G is coming, as you know, 6G is on the radar. The quantum communication is there. That's why we work on the quantum communication and quantum technologies at INL. If we go to the computation part, we have the computers, from small computers to supercomputers and then to quantum computers. So it's the same thing there, right? And then the analysis, we used different kind of, let's call it big data analysis, like AI, deep learning analysis. So this creates some kind of a smart society, if you like. And this kind of flow from the left to the right. It goes also from the right to the left, because when we have a problem and we analyze the data and the data is not enough, we need new sensors in order to provide new data. So everything goes back and starts again. So it's like a cycle, always go around. So this is how we can make a more predictive, efficient, and safe Europe. So the agenda for today, I have 5 points I would like to touch on. One is about the trillions of sensor economy. The other thing is about nanotech in the health tech, and then health data, the new oil, if you like, or the new gold. And then one very important part, who owns the data being generated. And then I will say some few words about the COVID-19 situation and how we are addressing that and how we believe that can help. If you think about society now, I mean, we are immensely connected. I mean, we have all these different possibilities to communicate with each other, and we do that now even more than ever before due to the pandemic situation. If we look on the megatrends, I think all of us know about these megatrends like the Internet of Things, the big data, the AI, AR, the VR, the deep learning, the sharing economy, the gig economy, if you like, the aging population, the urbanization that we are kind of facing, and the resilience of society, the Green Deal discussions in the EU, etc. And then the quantum kind of entering into the quantum regime, where everything going from the sensors to the computation and to the safety and security and good communication nodes. So these are the kind of mega trends that we are in right now. If you look on this picture, this is just a snapshot from a picture from Saigon, actually. And this is just a thought scenario, of course, that these kind of sensors are incorporated into these different people or into this environment there. And this is just to illustrate that we have a immersive technology already around us. And it will have radical changes. I mean, this kind of immersive technology. So it's not only about the data, it's also about the technologies that will have these changes. And as an example, 40% of the Forbes 500 companies will in a 10 years perspective be replaced with companies we do not yet even know today what they will work on. So this is the immersivity. This is the kind of rapid exponential growth that we are predicting for the future. So we will have this. And here comes the trillions of sensors economy in. So everything is about the possibility to put sensors on everything. So it's a total sensorization of society, everything from our environment, our water, our air in the room, our acoustic signals, sound, vibrations, forces, whatever. Everything will be sensorized. And this is the realm of the trillions of sensors economy. And the reason for it is, of course, as a natural consequence of the microelectronics revolution now being so cheap, so we can make these sensors with such a big quantity that we can load them wherever we like and having them embedded, providing data. Of course, we need to know what kind of data that we intend to get in order to make the sensors. This is a forecast from Cisco that by 2023, we will have 5 million new jobs in the component industry. I mean, really making these sensors. 38 million new jobs in industry and 129 million jobs in indirect jobs as a consequence of this. And just to give an order, I mean, this is about 150 million jobs, right? So if you look on in United States, 2013, in total, it was about the same number of jobs. So we will create an additional United States number of jobs in a 3-year period from now. So this is the growth. This is it's an amazing, it's an exponential growth, right? So, and then just now around the corner, you know, the 5G is going out heavily. I think 6G is around the corner. And people are speaking about the Internet of Senses, which is a total immersive and connected environment with a lot of inputs to our sensors, our senses. So we will be able to sense the surroundings in a completely different way as of today, which includes everything, not only the air we are breathing or the light we are seeing, but also our bodies that we can monitor and we can understand and make digital twins out of in order to predict what will happen as a consequence of various functions or various factors. So this kind of Internet of Senses is really rather futuristic in a way, but it's around the corner, so it will come. If we look on nanotech now, particularly in the health industry, sorry, and then defining nanotech as any technology that will improve global health related with nanotechnology and used in diagnostics, therapeutics, and monitoring. You can see to the left screen the patent applications 2016 to European Patent Office. It was dominated by medtech, so that is a dominating field. In Europe we have 675,000 workers employed 2016 in the medtech industry, and you can see where the big part is, of course, related with the size of the countries and also the kind of development of the industry in these countries. So if we look on just as a snapshot in let's say in oncology, So on the left side here, we have a panel about science-driven evolution. On the right side, about technology-driven evolution. And don't bother to read too much, but read just the lower part. So from science part, understanding diseases, it really understand. And if we can understand, we can also predict, we can also put efforts to do things, right? So new diagnostics and therapy options. Regeneration of tissue, artificial organs, organ on chip. So we can do in vitro studies instead of in vivo studies. Monitoring body functions and environment. Remote care and surgery, which is all about data, of course. Assisted better diagnostics. Having our own personal avatars, our own digital twins that we can monitor through some kind of interface, so we can better understand what we shall do individually. And then the minimally invasive surgery and patient engagement, which is maybe one of the most important thing now in this data-driven society. And that is about a topic I will touch upon later, who owns the data being generated. So this is just a kind of a illustration. So as an example now, where is health going, right? So health in a holistic perspective, we have an aging population. We have the urbanization problems. We have the food supply, the clean water, pandemics. We're living in the pandemics right now. Lifestyles, obesity, the multi-sickness panorama, and then the big data that we are seeing the kind of a bit of the top of the iceberg now about the big data. And we need to kind of change the way we educate and teach people in the care sector, of course, in order to be able to take the right decisions based on the big data. But the problem we're having here is, of course, that we have a health system ceiling. And the health system is our taxpayers, right? So it's about how much money can we afford to pay for the health system. So that is a ceiling. And we have all these things happening in society, all these kind of holistic things. So we need this kind of holistic, inclusive health perspective. And the way to kind of address this is by bringing together actors, creating the ecosystem, if you like. And this is exactly what I think David spoke about before, how to bring people together in an ecosystem in order to address these things, because they are complicated, they are big, and they are very important. So how to achieve this? If we go to the nano in the health sector, I touched upon these things to the left side, but just to read it out, novel materials, it goes into the pharma, it goes into the medtech, it goes into the diagnostics, data capture, it has everything to do with the sensors, and the sensors also with intelligence, so we can get the data at the point of interaction, and then also aggregate the data, so we don't need to communicate every single bit of information, but an aggregated view. And then the lab on a chip concept, which will help us to do much more quicker laboratory kind of decision making. Digitalization, of course, care, expert systems, personalized medicine, explore the interfaces, the system integration, industrial uptake and development. So, and everything has to do with, it must be meaningful. And this is the whole generation of today, our XYZ generations. They don't take a job just because they would like to have a job. They take a job because it's meaningful. And we have a big possibility here to explore the health sector when it comes to the digitalized health sector and really provide a lot of meaningful jobs, which will increase a lot about the meaningful healthcare, of course. And it has to be emotional. So what are the next steps we need to take here? What do we need to do now? And I think what we need to do now is something that is very complicated, because we need principally to do the following. We need to provide something to people that have no time to get engaged, because they don't have time. So they cannot take up new innovations, they cannot take up the new ideas, because they're just so busy running where they are. So I think this is a challenge that society has. It's a challenge for nanotechnology, for sure. It's a challenge for the trillions of sensors economy, but it will happen. So the question is, who would do it first, right? So what we need to do is to kind of switch the health pyramid in a way. So instead of seeing IoT in the top or the data in the top, it is really in the bottom. It's where everything starts. It starts with the possibilities to sense things, and we need technology. We need a nanotechnology. Then we can do preventive care. We can do wellness, nutrition, and medicine. So instead of spending a lot of money to taking care about sick people, we spend the money to take care about people stay healthy, so they don't get sick. So we need to change the pyramid in a way. It's not so easy. There is a need for this mechanism. Right? There is a need to allow ideas to flourish, release the power of individuals, compound and match ideas to a certain challenge. And this is for everything, for organizations, companies, associations, municipalities, countries, and EU. We all need to do these things. If we do that well, we can have a much better understanding. So instead of giving this fragmented understanding, we can big the picture so we understand what we're really talking about. So if we don't have the big picture, then we will be blinded. Right? So it's about connecting, but it's not connecting in a meaningful way. So the mega trends in healthcare now is, of course, that the healthcare provider and the telehealth or the telemedicine has accelerated enormously, and especially now during the COVID situation, of course. The regulatories are seeing the next big thing or the next big thing being the data-driven care automation. And patients are, on the other hand, demanding digital care, and they like to be comfortable with it. So they like to see that it really is fulfilling something for them. So these are the mega trends that we need to address in the health sector, I think. So the way we at INL is trying to do this now is to set up a kind of a platform that will be combining the different kind of telemonitoring, the teletherapy, the telemedicine efforts, in order to put up a platform that will be open to everyone. So it's one, I mean, it's simply what David spoke about before, to provide something that is a single unified possibility for everyone to be engaged, right? So it's to have the communication, it's based on outcomes, but it's based on partnership with everyone that like to participate. And we put up the platform in order to enable the data flow, but the data is coming from people that would like to contribute to the data, of course. So this is our vision, to have an extremely good, united, connected platform where everyone is allowed to share the data and be part of. So if you think about in a more simple way, maybe if you think about this body and mind, the symptoms and the diseases or the threat and so on. To the left, you have the body. We have all the inputs there, food, air, light, etc., etc. We have the body, and then we have some biomarkers. That is what we're measuring. These biomarkers are depending on the lifestyles, of course, and it will be orchestrated by different kind of symptoms. And then we have the precision medicine, where we try to do some support in order to take care about people having symptoms. But in order to put more emphasis on the well-being, we can use all the sensors in order to have a much more predictive, much more ahead kind of discussion. And by combining the preventive maintenance with the data analytics from a kind of industry 4.0 perspective, we can do the preventive maintenance of ourselves and having a much more better possibility to actually have a better health tech sector and healthcare sector. But the question here, of course, comes to who owns the data, because all this data that generates enormous data flows, and we as people, we donate our data to actors. And when we do that, we pay us a fee for doing that. So we pay a fee for someone providing us help or providing us security. And then that someone will take the data, aggregate it, and we are happy to contribute with our data because we would like to have a better world out there. But on the other hand, we don't want to be kind of hijacked with our data. I mean, it's my data. I would like to own my data. So we need to develop some kind of system, I think, that will allow people to actually be part of the data economy. And we can do that. And we are putting some efforts into setting up a governance of what we call a common systems, which is a very interesting way of kind of matching a supply and demand and making a playground where we can have a possibility to actually, by different kind of smart contracts, have the possibility that the next generation assets that is delivered by the data that people are using in different circumstances will actually make a kickback back to us that are providing the data. So it's a way to have a shared economy, or a way to have a better way to have an involvement of society, involvement of the people in Europe. Now let me go a little about the COVID-19 pandemic. So we know about it, right? So we know what happened in the beginning of last year or the end of last year, and then how we have had it this year. So we know everyone was talking about flattening the curve, and there was a lot of research, interesting articles. And what was really happening was that the research became into the public space. So people got concerned about that different researchers worldwide were contradicting each other. And this is not the public used to, because usually when they read something from research, it's after the peer review, it's after being discussed in the research domain, in the research dimensions, and then you present one finding, which is kind of the outcome of the findings where many researchers agree and where the research has been proven to be reproducible. Now, suddenly it became into the public space because all newspapers were interested to write something new. And then this debate, the normal research debate was suddenly in the public space. And that created a lot of confusion. It created people saying, oh, why cannot WHO say how it is? Why cannot my national government tell me what I should do? Why is there so many different opinions? And the reason was because, I mean, it was just brought to the public space and we were not ready to do that, right? So the failure of the system that we didn't respond in a good way. And what we also noticed was that every country became very national. So every country started to put up funding possibilities, do their own lockdown, do their own kind of copying different kind of activities, etc. And now we are, of course, in this restarting economy, that the restarting the economy is the priority, while we're having a world around us that is just as difficult as it was in the spring. And now we do different things. So what is really the learning outcomes out of this? I think the learning outcomes is that we need to work with each other much more. We need to talk with each other much more. And we should not close our national borders, but we should speak with each other. And what is kind of clear is that there is a need to have a much more interdisciplinary and community-focused research. So it's a possibility for everything that is interdisciplinary in a way, which is a possibility for INL now exploring interfaces. So, and I think this is interesting. So when we go to what we have done at INL is that we are in close contact with the governments of our member states, but those other governments. We have a good contact with the worldwide network of people working on different kind of strategies in order to come up with solutions to fight the COVID situation, and working on to establish the strategy to enable the society to go back to new normal, and then do concerted research activities with many different countries, and setting up a worldwide stakeholders concerted action. And what we focus on is to provide value in this restarting and post-COVID phase. So the key questions for us is not to have a diagnostic system. The key question is not about having a care system, intensive care units. That is the health sector. What we are concerned about are the key questions. If you're sick, if you're immune, if you're transmissive, and how the transmission progresses. So these are the topics we are focusing on. And we are putting some activities in order to have activities in these different areas. So we're working on point of test, point of care, and then the more bigger ones, we could be homes, offices, etc., where we can detect the transmission of COVID through the air or through the water or to the drainage or to the sewage system, etc. So it's by putting sensors in different markets or different aspects that we can get a more holistic understanding. This is one example of a test that we have been working on that is now ready. It's about a 30 minutes colorimetric detection. It needs a conventional laboratory setup. It's a clear colorimetric response. If there is a color there, then you have you are infected. This 98% specificity, and it's saliva sampling, and it can be done in cohort. So you can have 10, 20 people in the same saliva collection, and then if anyone is COVID, then you can go down and test each individual. So this is one way that we like to contribute. This will be rather inexpensive. We are now making this into an integrated lab on a chip setup. So we're putting a microfluidic chip there and do the same kind of thing We have a cartridge reader, we had a readout, and it will also be rather inexpensive. So just recently, another laboratory in the world in Illinois just showed a similar kind of cartridge test that they now do 3D printed kind of tests on. Another thing that we're putting emphasis on is breath analysis. And then the breath analysis, there are many people now working on that. Here are some examples. We could say there are maybe two, maybe three solutions. One is to do these volatile organic compounds, which is principally working like an alcohol detector. So you try to find some volatile organic compounds, and then you do some data massaging in order to understand using some kind of concept, could be artificial nose concept or something else. There are a number of these. Most of them are quite big, and the costs are quite high, and the reliability is not very good. Then there are some other ones. There is one from Ben Gurion University in Israel, which is a rather nice thing. You see this picture to the left there, which is something that you blow into. These have a fast detection, 5 minutes. It's based on terahertz detection. And it doesn't really matter so much if there is a biological activity, so it more measure the particle. So it's a particle count, if you like. This is a high viral load. The cost will be about 50 euro because it's quite expensive to make these sensors, these terahertz detectors. So it's not really a good solution. Just recently, last week, IMEC introduced a solution, which is also a breath analyzer. They doesn't really say how it really works, but the cost will be about the same, about 50 to 100 euro each. So it's not really a real good solution. We are working on a breath analyzer at INL as well. We do not care about the detection of the biological entity, but more again about the particles. So we measure particles. And then we have a solution now that will be able to get out to a very short time of detection in the order to minutes with a cost of some 5-10 euros in the consumer market. So I think this is something that can be used on an everyday basis in order to get the economy to come up. So I've gone through the different points. I just give you a picture of INL, how it looks like. It's a 100 million euro investment. And we have a rapid prototyping wafer lab, a 200 millimeter wafer lab, which is based on industrial grade machines. So we can do rapid prototyping, and then we can transfer it to the big production facilities like Tower Gas in Israel, TSMC in Taiwan, etc. So they can do the multiple copies. We have very good high resolution electron microscopy and spectroscopy facilities, nanophotonics, and then the different activities that we're working on. So just to, I think, let's see, what is the clock? I don't have so much time. Just to give you a very, very short overview. So this is just how it looks like. It's very modern. It's very nice. It's interesting. People now, 420 people from about 40 different countries working together in an interdisciplinary kind of environment. So this is just to show a snapshot. I stop the video here, and then I will just say thank you for listening. Thanks.
Yes, thank you so much, Professor Lars Montelius. We are so proud to have you as our global R&D partners, and now I understand why it's such an important partnership for the Health Data Forum, because we also aim to have the global hybrid summit. We want to reach not just Europe. Of course, we have here David Novillo Ortiz, which is the responsible of health data and information in the WHO Europe, but also to the rest of the world. And it's really important to have this global reach. But on any other sense, we have very few minutes left here. Maybe, David, you would like to comment on this presentation about potential partnership you could arrange with INL, also for your purposes here in Europe?
Thank you so much, Paul. And this is a really very interesting, and it's a field that we are really exploring. So yeah, happy to discuss further this potential collaboration. Yeah.
Excellent.
And it is interesting because David is a Spanish citizen. Of course, he's working in Copenhagen. And I'm a Portuguese citizen, as well as I'm also a Spanish citizen. So it's like finding in our own homes, in our backyards, this interesting laboratory that it's funded by the Portuguese and the Spanish government, so far-sighted countries in this respect. And Lars, maybe you in Sweden, you know, but it was Spain and Portugal who drive the first globalization, real globalization revolution. So maybe, who knows, out of Braga, we can start here a new era in the world. And I particularly love the slide you mentioned about the way of people are so busy that they cannot find their time to see that this is what we really need. It's a new paradigm, because on the same paradigm will bankrupt.
Yeah, no, this is the challenge we have, whatever the kind of topic is in a way, right? Because we are so busy that we don't have time to listen, right? So.
Absolutely. My friend, thank you so much, dear guest speakers, for having this time here with us. We are approaching the close of the time. Any final comments you would like to share with the audience? We are live stream now. And
no, I just would like to say welcome to everyone. I mean, we are happy to work, and we really would like to do things together, right? So please contact me or Paolo. I mean, you have my details. So,
David, any final comments?
Same here, Pablo. So my email is in my presentation. I would just to say, to complement Lars' presentation, I prefer to say that data is more water than oil. I prefer that analogy. Because we cannot live without it. So, but yeah, but happy to continue this conversation. Thank you so much.
Thank you.
Thank you. Thank you so much, dear guest speakers, and thank you for your contributions in the global keynotes. And now we have a short recess, and we start the 3 o'clock main room for the subsequent panel. Thank you so much.
Thank you.
Bye.